How soon after ACL surgery should you start your rehab? The answer might surprise you. My name is Dr. Marco Lopez, doctor of physical therapy and certified strength and conditioning specialist, and co-founder of the Basketball Doctors. So let's jump into it, guys. So if you just had ACL surgery, when should you start your rehab? That is a question that we get asked so much. Some people say, hey, I have to wait 2 weeks. Other people say I have to wait 1 week. That's when I have my appointment. But the rehab actually starts right after your surgery, and we're gonna explain why. So when it comes to ACL reconstruction surgery, and you click down below, we have a great video on some of the main goals that we need to achieve in the first month. The main goals after surgery that we want to achieve, especially in the first week or first couple of days, is learning how to manage your pain and your swelling. And then we could go into some of the exercises. But the rehab isn't just exercises, it's learning how to manage these things. So the first one is, how do you manage your pain? And the big thing is, we have to be really working on cryotherapy, icing it, and if you need to take some pain medication, maybe take that as well. But the main thing is you got to learn how to manage your pain, because if you have too much pain, you won't be able to do your rehab or your exercises. The second one kind of goes hand in hand. A lot of the pain comes from excessive swelling. So how do we limit excessive swelling of gain in your knee? Because as we know, after surgery, it's normal to have swelling. It's part of the healing process. The thing is, we want to limit how much swelling we're getting. And the way we do that is spending less time on our feet, elevating our feet, compression, ice, all these things, and some slight movement will help with some swelling in the knee joint itself. The other aspect that gets underrated is, like, how are you eating? Are you still getting your protein in? Because when it comes to this surgery, you're going to be losing a lot of muscle because you're going to be sedentary and you can't really do much. So the rehab starts right away is really emphasizing protein so you can minimize the atrophy of that quad muscle. The other aspect is the sleep. How are you able to get some sleep? Because sleep is huge when it comes to the healing process. And a lot of times, take it from me, I had ACL surgery. It's really difficult to sleep. But the rehab starts there. Like, how do you find ways to find the most comfort to be able to sleep while elevating your leg to decrease that swelling? So all these little factors before we even get into the actual exercise component are things you need to be working on as soon, hours after your ACL surgery, because more likely than not, you'll have a nerve block. You'll be able to walk out after ACL surgery or maybe go in a wheelchair. But that's when we really start working on these things, on minimizing that pain, minimizing the swelling, and really getting your sleeping and eating right. Once we get that, I normally have people start doing some of the rehab exercises on day 2, right after 24 hours later. First day, really just try to calm that pain down, get some of that swelling down. The second day, I like to have people, hey, the big things that we need to be working on towards the end of the month, let's start with that right away. And that's one, is really trying to get that quad activated. So I tell people throughout the day, even if your knee's like covered up with all this bandage, try to really think about squeezing your quad, because when you squeeze your quad, you're going to be sending that signal. And more likely than not, especially right after surgery, you're going to have a good quad contraction. It just starts getting worse and worse throughout the day, throughout the days of following surgery. But early on, the first 24, 48 hours, I've seen athletes have a good quad contraction. They're like, oh, this is nice. And then they start losing it because there's more pain, more swelling that comes in. But just getting that quad contraction is going to be huge. So every time you look at your knee, just think about squeezing. And one big tip I tell people is, you're most likely laying down, squeeze both of them, because that's going to help out squeezing the injured leg. The other thing is just getting some gentle movement in your knee. Just slightly bending your knee, slightly extending as much as you can. Some surgeons even prescribe that CPM machine where it moves your knee for you. It's, some surgeons do that, some surgeons, but even if you don't have it, it's okay. Just you doing some gentle bending and extending is going to be huge. And the last one is really just trying to trust your leg. Standing with crutches, putting weight on your leg early on is going to be huge to minimize that muscle loss. It doesn't mean that you're going to go out for a long walk. I just want you to just start putting some weight, distribute the weight, just to kind of really get that feeling back. But the rehab, like we mentioned, starts early on, and you want to really start addressing the main factors of pain, swelling, sleeping, and eating right away. Then you go into some of the exercises. because here's the cons of waiting long. A lot of people come to us saying, hey, they told me just to rest for a whole week. Other people up to 2 weeks or 3 weeks, and sometimes they have issues getting a therapist at that 2 week. So you want to have all this prep before you go into surgery. Like, hey, I want to see my PT. Usually I tell people the 3rd day is a sweet spot. You know, you don't want to go longer than that. 3 to 5 days is kind of like, we want to get things to get moving and start doing stuff. If you wait 2 weeks, you're gonna, 1, lose a lot of muscle. 2, you might have some more swelling because they haven't educated you on best practices to minimize that swelling. And 3, your knee's also gonna get really stiff because you probably didn't move it because 1, you didn't know what to do, or 2, you know, because of the swelling and other things, they're restricting that range of motion. So those are the cons of waiting a little bit longer before you come to your rehab. You might have that increased swelling, more atrophy, and it just kind of sets you behind, especially if you're an athlete, you want to get back to your activities. So hopefully you guys learned a little bit about when you should start your ACL rehab. It's sooner than you think. It starts right after you have surgery, and all these little factors you can do that don't include exercises. But if you guys have any questions regarding ACL rehab early on, we have a great video down in our description below with our goals that we want to hit in the first month. But if you guys have any other questions, comment below. We'll try our best to answer it, or send us an email message. We work with people here in Southern California or online. We are the Basketball Doctors. Hit the like button, share this with friends and family, and let's ball for life.